Hi, good afternoon, all. Thank you for listening in to our challenge. My name is Nico. I am currently a pharmacist at the National Cancer Center, Singapore. Okay, and with me, we have Lita, my boss, as well as Franklin, our director from the Office of Organization Transformation as well, who will be helping us to pick any questions later on. Okay, so my main presentation today is about pharmacy service experience. Next slide, please. Yep, so we were always thinking, how might we create a patient-centric end-to-end service experience for our patients requiring the pharmaceutical care journey, and as well for the staff involved in their care journey. Next slide, please. Okay, so the challenges we face now, I think it can be extrapolated to all the pharmacies in our cluster as well. Okay, it's the waiting time. We have to fulfill our KPI of less than 30 minutes, 95% of the time. And we have an overcrowding in a small space. So example, in the National Cancer Center Pharmacy, because of social distancing measures due to COVID, we now can only house 3 chairs. Okay, so that's how small our place is. And there's also little integration in our workflow and systems. All in all, to supply a patient medication after they see their doctor, it takes about more than 30 processes. Next slide, please. So why does it matter to us? Because as you know, SingHealth is, our mission statement is really patient at the heart of all we do. So it's a complex journey that our patients face, and pharmacy is often their very last stop after a long day at the center or at the clinic. So a tired patient may not have the best experience, but they do need to know the important medication-related information. And do patients really need to wait at the pharmacy after a long day? So this is a typical journey, okay, that our patients have to cover. So they come in at registration, and then they register for pre-consultation tests, and then they have to wait for their consultation. And then after waiting to see the doctor and finish seeing the doctors may order more tests. Then after that, they may be sent to a counter for appointment scheduling. So in the case of cancer center, patients may also be scheduled to receive a chemotherapy. It may be or may not be on the same day as they consult. And then many often patients would have take-home medications. So they have to be triaged again and waited again at the outpatient clinic pharmacy, and then after which they will go ahead to pay for their medications. Yeah, so this, as you can see, is quite a long journey. And so by the end, when the patients reach us, very often they are very frustrated, okay, and after the long wait, and they may not really be in the best moods to actually listen to you about the counseling of medicines, which are really important to them. Next slide, please. So we thought, is there any opportunity to actually improve this experience for our patients via a virtual pharmacy? So each of these colored dots actually indicates a process, okay, by which most patients will go through. Okay, so the blue dot indicates a triage. So so we're hoping that, you know, instead of like queuing up at the pharmacy and being manually triaged. Okay, so when we say triage, usually we mean to ask our patients, is this the medication that you want? What is the quantity of medication that you want to collect this time? Okay, so this are the basic triaging functions that pharmacy does. Okay, so we hope that instead of going to the pharmacy triaging counter and, you know, form another queue or wait there, could they see from the comfort of their own handphone through a virtual pharmacy? Could they see the wait time that's at the pharmacy? Could they opt for medication delivery? And could they opt to pre-order prescriptions? Let's say they don't need a prescription there and then, but they can always come back and collect it some other day. If really they need the medicines urgently, they will opt for face-to-face counseling. So is there an opportunity also, you know, for them to be able to choose this from the comfort of their own handphones? And would AI be able to help our patients make a guided choice? So for example, if our patients have actually gone through, have actually collected medications through home medication delivery service before. So if it's the same drug, no other major concerns, could we straight away allow the patient to be triaged for medication delivery? Okay, so this is one aspect of it. Okay, in terms of a medication delivery, service. So as you all know, in the COVID, we actually don't really encourage patients, if possible, to come to the pharmacy because it's pretty overcrowded, and we want to we want to reduce the risk to them. Okay, so we actually encourage people to opt for medication delivery services where medications can be sent to their homes, to their office. But these processes are very there are many processes for a patient, okay, in order to opt for the medication delivery services. First, the pharmacy staff need to check for the eligibility. So as I have mentioned just now, if the medication is a new one, it's an antibiotic, has to be taken immediately, the patient would not be eligible for a medication delivery service. Okay? And patient needs to sign consent. Okay, so in order to opt for the medication delivery, we need their consent, and very often we will need them to sign on the spot, or we need them to return by email to us, which can be a cumbersome process. And right now, booking delivery slots, we don't have an automated process. Okay, so is there any way where the patient can book a delivery slot at their convenience? And then is there a way that can track the logistics of the completed medication delivery service? Example, if the patient, there are any status tracking and updates that could update the patient so that the patient doesn't have to call our ever hot hotlines in order to get through us to check their delivery status. Okay, so I must say, so there are many solutions we want to put on a virtual pharmacy platform, but what really we think very important right now at this current stage for us, I would say it's the blue and the red dot. But notwithstanding the green, orange, and the purple dots, they are equally important. Okay, but I guess in a priority version, the left-hand side would be a more priority task for us. Okay, so going on to the right-hand side where we talk about patient information, counseling, and education. Okay, so there are many platforms for which a patient can receive medication-related information. So we do have our Health Hub, Health Buddy, SingHealth Health Buddy apps, where patients can, find the patient information leaflets. Okay, but what we're looking for in this solution is really like a customized counseling experience and medication-related information for the patients. So it will be supported by a drug image library, okay, as well as a brand archive. So many often patients are, it's very difficult for patients to articulate the names of the medications they are on. Okay, so as pharmacists and frontline, we always face challenges, when patients tell us that, oh, it's a white tablet I'm taking. Oh, and sometimes when we need to counsel the patients, we need to ask what are the medications they are on. So we do face challenges there. And we hope that we could actually have a drug image repository, okay, and where we can drag and drop and create a customized counseling for our patients. So for example, patients on drug A and drug B. So if we can just drag and drop drug A and drug B and to show the patient, okay, so this will be the list of medicines you are on. And then you're followed by QR codes, where they can actually scan their PILs or whatever. So we hope that this may be some service that we can offer to the patients. Okay, and in terms of brand archiving, this is a particular issue in our pharmacy as well, because drugs, they change brand. Okay, so the same drug can have many brands. Okay, so sometimes patients are quite confused and they are not sure if, because it's a different appearance, they will take it that it's a different drug. So they may have some old supplies at home and they will have the new supplies and they will take them all together. So if there is a way to tell the patients, that hey, actually these two brands are actually the same medicine, you only need to take one of them. Yep. Okay, so for the next sector will be the telepharmacy. So we are hoping to also embrace technology in the sense to allow us at the pharmacy end to monitor patients for their side effects from the medications, especially after they're started on first time on the medications. And in our setting, cancer, chemotherapy, and targeted therapies, okay, this becomes even more relevant to them. And then whether we could have such a platform, okay, and then we could actually monitor them. And then this platform could also give us reminders as to when we need to follow up these patients if there are problems. Okay, so the last function we are hoping that this virtual pharmacy will embrace is really medication reconciliation and adherence. Okay, so we hope that patients would have an updated medication list every time after they see us. And there's a balance stocks function. Okay, so this balance stock function will also help to prevent patients from overstocking or stockpiling their medications at home. This may lead to safety issues as well. Okay, so if they are able to let us know like how much balance they have, especially for also for expensive chemotherapy agents, then it probably would be a good function for them. And reminder functions. So I know there are a lot of reminder adherence apps out there in the market. So how could we actually put them in together in this virtual pharmacy? And the last stage is exemption drug tracking. Exemption drugs just means that these medicines are usually not registered in Singapore, but they're brought in via another way. Okay, so we do face issues in tracking and make sure that patients have a continuous supply of such medications, and whether this balance stock function can actually trigger a whole chain of information to the physicians, to pharmacy for reorder. Yeah, so I think one of the challenges, as we all know, would really be how do we overcome interface issues with the current systems and the strict security. Okay, so the later few slides are actually really zooming in on each various bubble, which I believe I've actually explained in detail. Okay, so I would stop at this point and take any questions, please.
So questions for Miko, please type into the Q&A module. Actually, Miko, just picking up on the last thing that you said, how to overcome the interface issues with current systems and strict security. Any words of advice?
Maybe, hi, this is Franklin. I can take that for if Miko is okay. So I guess why we put it there is, I think, you know, it's certainly not going to be a standalone system that we have out there, because from what Miko has described, we really want this to be able to sort of pull information from various sources, and so there will be integration. And I think with integration, there will be that security clearance. So the team that will want to collaborate with us will need to work with, you know, IHIS, who is the provider who works, you know, for as far as public healthcare is concerned. They are the company that, you know, basically helps with our IT security and all the, you know, some of the integration. So this is probably to manage expectations that whichever vendor or partner that comes to journey this with us will have to work with you know, IHIS in this respect. And there will be certain security guidelines to clear, which I mean, we don't want this to be a technical discussion, but there will be some of this, whether it's on cloud, on-prem, what can be, you know, what sort of API is available, and, you know, with, you know, that sort of technical discussions will be required. So it's not really creating a standalone system. I think that's where, to manage expectation, we put it there. There will be some of these discussions once for considerations. I think sort of we're putting out there so that the partners realize it.
Yeah, thank you, Franklin. So let's get to a couple of questions on the Q&A panel. First from Rami. Do you use eRx? What system do you use for managing prescriptions?
Okay, so at SingHealth, we use the SCM, Sunrise Clinical Manager, for the ordering interface, the physician ordering interface. And for the pharmacy system, we use MaxCare, which SCM will flow into MaxCare. And that will be the main dispensing engine that pharmacy uses. And the next question by Mr. Tam Hong Yuan. What type of drugs can be delivered, or is there any type of restriction? So currently there are, we deliver most of the drugs that can be delivered. Okay, of course, there are some restrictions like with controlled substances. That we don't do delivery, and sometimes temperature label or fridge items. But we're hoping also to actually improve the range of drugs that we can deliver. And also expensive drugs, which can cost many $1,000s per month. So these are some of the drugs we are looking at into solutions to try to deliver them as far as possible.
Okay, thank you, Miko. Any other questions for Miko and Franklin? Please key it into the Q&A panel. Whilst we're waiting for that to happen, just a couple more questions from myself, if you don't mind. So right in the middle of the page, you say one-stop pharmacy service, and everybody must be thinking, oh gosh, I've got to do it all. And Miko, of course, you said that triage and medication delivery is a little bit more important at the moment, right? Just get a sort of clarification from you. Are you expecting a super app that does everything, or where could we start? What's the most pressing thing that we really need to solve at the moment?
If you want the honest answer, the most pressing thing we really need to solve is really the medication delivery. And I think the triage is probably very useful for us as well.
Mm-hmm.
I guess it also, we are also, like Franklin has, we are also quite practical in the sense that, if we could look at certain solutions, like of a lower hanging fruits, without having that much of an interface that we could tackle first. And so we're looking forward to innovations and solutions from the industry and the vendors, if they can suggest anything to us as such as well. Yeah, and then as to the virtual pharmacy, the imaging and the drag and drop functions. Okay, I guess that would be what we require as well. Yeah, so to be greedy, we actually wanted all that, but we do understand that it's quite impossible, for that. Yeah, but we're willing to look at different permutations, which would in fact help us like even simplify one little process and improve the patient experience for our patients. Yeah.
Yep. And if I can just add exactly like what Miko said, of course, the fact that we come here means this is all a burning platform. But having said that, just to elaborate a little bit, when we talk about having it one stop, we certainly are not looking at, can you use Zoom for telepharmacy and then use another different app for delivery, and having patients to at the end of this download 6 different apps to manage all these requirements. Certainly that's not what we are looking for. So certainly some form of integration. Is it a super app? We are open. Whether is it an app version, what channels are available? I think that's we want to see what ideas can come in. And to clarify a bit on the medication delivery, so that again, to share a bit more, we are not looking for full-on, Amazon, Lazada, Zalora's logistics system of warehousing of our medication. No, it's really, as what Miko said, it's to help to do that management of how to book slots and stuff like that to make it more efficient. So maybe a little bit of clarification on that as well.
Okay, thank you. So for example, if somebody comes with a really, really good solution in telepharmacy, the first time counseling, for example, and something that you can immediately see its usefulness, you would consider that, even though it's not the most pressing thing, but it really is a great solution to a problem.
Yep, I think we are open, as what Miko said. Possibly also looking at how do we phase it in that sense. Of course, the preference would be somebody coming with at least a little bit more of that thought of how to integrate it all together than just isolated telepharmacy solution, for example.
Okay, I think that's a question by Mr. Xie Qi Huang for the drug image library. I'm aware that there is already MediView. How different should the new platform be? Yeah, so for MediView, this is really a great platform, and it's also, it was started by a group of pharmacists who thought that this was a very important issue for our patients. Yeah, and so we do use this MediView on a very regular basis as well, because this is one of the more exhaustive image libraries. Yeah, but we are also hoping that this can capture more drugs in terms of their actual sizes. Okay, so the tablets, the bottles, and how, the image and how big they are actually, because this sometimes do play a part in our patient counseling. And MediView, they do not have the entire database of drugs, especially those that specialty centers keep, like the cancer center. And one of the differentiating factors is also we are actually looking more for like a patient and a staff-friendly interface. When I sit with the patient opposite me, I have an app okay, which I can open up, drag and drop out and create a customized counseling list with the images for the patient. Yeah, and many of the times, why do I say sizing of the medications do matter? Okay, I'll take, for example, a very commonly used medicine, like a bottle of medicine for constipation. Okay, so when they look at the image, the bottle can mean this size to them. It can also mean this size to them. Yeah, so if we do have a good reference, okay, that would actually help the patients determine how much they need to bring. They want to order home. Okay, because sometimes when the medications just come to them, oh, it's such a big bottle, I didn't realize I really didn't need any. And there were a lot of reworks and then. So this will also be particularly useful for pharmacy satellite counters that operate remotely away from the main pharmacy where we don't have the actual stock pictures or the stock of the drugs to show the patients. Yeah, so there are actually a lot of usages for this particular image repository or functional system. Yeah.
Thank you. We have a few more minutes left. If anybody has any more questions, key that into the Q&A panel. Meantime, if you could indulge me, I noticed that you have a bubble there that says AI helps patient makes guided choice. Well, AI can really function if there's data. Can you share a little bit about the sort of data that you currently have or can make available later on for the pilot, for example, such that we can make this come to life?
So I guess, okay, so I'm not sure whether all this data can interface or not. Okay, so I'm not a very technical person. So frankly, please correct me if I'm wrong. Yeah, but the thing is that, we would have collected information about previous medication delivery services that the patient had. So for example, so would there be something like, oh no, the last time you collected this chronic medicine that you need to take forever, kind of thing, or you were actually running close to the next cycle already, would you want to trigger your medication delivery? So if we know that patient has actually taken this before and for a very long time, yes, definitely this patient is eligible for medication delivery services. Yep. So this is the kind of information like patient past consumption patterns that we can look at.
Yeah, hi, Lita here. Can I just add on to what Miko just said about data? We have plenty of data, all right? And every patient's, their journey has lots and lots of data that we collect. But we don't have a platform where you could turn this data into meaningful information. And if someday someone could do this, what you can do is patient archetypes. Okay, once you know the pattern, every patients, they all come with certain pattern, and you could predict some of this pattern. You'll be able to do predictive analysis and then be able to predict the patient's journey and even what they want. Instead of today, we are just pushing and pushing information. In future, you could pull and then push, and then it's a lot more meaningful work. Yeah, and that's what I think. If you look at the entire picture, we have many broken segments. They're not joined. And you asked earlier whether do we need really a super pharmacy system to do this. My answer is that certainly. Okay, if that could be done, that would be great, because today it's broken into so many little parts. Okay, I don't mind different parts, but different parts must talk and work together to form an ecosystem. Today we don't even have an ecosystem that works, and every interface is a human intervention, and that's really not not just friendly to staff, but not friendly to patient, and certainly not safe. Yeah.
So just to add on exactly what Lita and Miko are saying, and with data, and that's why we are here. Some of these platforms or solutions, it's available commercially, but we are not looking in that sense for a commercial partnership. We're looking for a collaboration, and with the data, I think partnering the correct partner, it really can come up with something that will really benefit the patient, and it's not out there yet where we can. And part of this triaging, I think, tip of the iceberg is also triaging with data. We could do a lot more in fact in all the bubbles, definitely.
Yeah.
Thank you. So maybe one last question from the Q&A panel. Will the personalized video for each patient based on the prescription would be acceptable?
Explain a little bit about what is this personalized.
There's a link
based on the prescription.
If I can click on the link and have a look.
Yeah, Remy, if you would like to follow up with
Okay.
explore that.
I don't think we might have time to look at the video itself,
Yeah.
but if I can just take a stab at it, they're talking about, you know, being able to, based on a medication that's prescribed to that particular patient, and come up with, if the solution can come up with exactly to describe, okay, this almost replacing a person, a human.
Certain,
Yeah.
yes.
You know, take this tablet. This is for your headache. This is for your fever. 2 times a day, 3 times a day. You know, this is how it looks like.
Yes.
Like, you know, I possibly, but
Possibly,
you know, if
yeah.
it's doable. But you know, just to give you an idea, we have close to almost 2 million outpatient visits a year. So you know, if that means 2 million personalized video, we also are mindful. So I don't. We can go, certainly. I mean, the link is useful. We will go have a look at it. But I guess the short answer is, I think, you know, we are open to any innovative solution that can address some of these challenges.
Okay.
Yeah, there will be application for such homogeneous kind of implementation. But by and large, you would probably need to cater to differentiation. And I think, you know, sometimes after you send the patient a personalized video, you might want to use a chatbot function to ask them, is there anything else that you need? Because you can't give this to, you know, to be every single new patient who walks in with that particular drug, okay, because that is a standard information that you want to give to every patient. But again, each patient will come with different concern and different question, and that video cannot explain it. Right? You may then have to combine another solution like a chatbot where you cater to differentiation. So the answer is yes, the video will be useful, but it cannot be the only solution. You have to add on and be able to rescue patients who fall through the net. Yeah.
Yeah, exactly. You know, like, you know, it could be for your delivery patients who are well, you know, generally, yes, they you know, you can look at the, you know, very generic medicine, but certainly you have to be able to supplement it with the personalized kind of information.
Thank you.
Thank you.
Thank you, team. SingHealth. We're almost out of time, but I thought perhaps any final word of advice from you. Your final pitch to the group.
Maybe I can go first, Lita, you can add on. Like I said earlier, just to repeat, you know, we are not going for commercial products because, you know, some of these are not new, but we really are looking for a collaborator to create something, to co-create something that potentially can, you know, like I mentioned, we see over 2 million outpatients, and this is what we are looking at. How do we help our patients out there in you know, the man on the street? And certainly this is a gap that we want to address, and the journey is not easy. That I think that we are not hiding it. That's why we have all these bubbles and caveats. But certainly I think the fulfillment of working together with us, I think, goes beyond that commercial viability. I think this is really something, you know, as what Miko has shared, you know, patients is really at the heart of what we want to do.
Yeah, that's right. We are certainly challenging many status quo. There will be changes in mindset as well in the way we do things, but we are certainly going out there to try to pitch for an ecosystem that will work, not just for the patient that we serve and the consumers that we serve, but for the healthcare family and also for the healthcare system. SingHealth being the largest, you know, public health institutions looking after so many patients, whatever solutions that we create and we co-create will have a huge impact, okay, to the healthcare system. And if this is achievable, all right, then I think we are insane enough to change the world, okay? Yeah.
We do have one last question. If I could just get your and I suspect the answer, we could be sitting here for the next hour. But if I could just get your very quick response to that question. The question is, why does it take so long to collect the medicine and give it to the patients?
Okay. Miko, you want to do it? We just discussed this yesterday.
Yeah. Okay. So I think there are so precisely. I think that's why patient education, not in terms only of medication, but the entire journey is actually very important, because patients have really no idea what pharmacy does at the back of house and what it needs to take to make sure that the prescription and what is ordered on them is handed and 100% correct, 100% safely to the patient. Yeah. So there are many steps involved in this entire process, and then that entails clinical checks, and that entails picking of the medications, and that entails correct quantity, correct labeling, and all this needs time. Yeah, so that's why you need to wait for your medications.
Yeah.
Yeah.
We have done so many versions of value stream mapping, okay? We'll try to be as lean as possible already, all right? But before even the medication get picked, there are already 6 pre-processed that needs to be done before a medicine goes in there. So even before it gets picked and packed, it already 6 pre-processes. And then after that, before it gets to the dispensing, and it's another 3 sub-processes. And at the dispensing, there's another 2 key sub-processes. You add all this process, by the time I get it to the patient, the moment the patient step in into the pharmacy at the triage to the time when dispenser call, right? It would have taken that number of minutes. Now, not every patient needs 30 minutes, all right, to have that journey. But by and large, all right, the fastest you can ever get out from beginning to end, all right, unless it is, you know, first patient, zero wait, no other person in the queue, but that's not likely to happen in our public healthcare institution. So you average it out, right? At 95%, 30 minutes, it's really a stretch to someone who has got 4 to 8 items in the prescription. You just imagine that the more number of lines in the prescription, the more likelihood of mistakes, and hence the more that you have to do at the back to get it right. Yeah.
And maybe just to add on, Nico, if I can, from a layman's perspective also, if you're imagining it's as if you go to Guardian Pharmacy and just pick up a pack of Panadol and go to the counter and pay, that takes you 3 minutes. This is not it. This is not it. Because like what my colleagues have shared, you know, that there are a lot of back-end processes, safety, predominantly safety, and some of it is also customization. If you go to KK Children's and Women's and Children's Hospital, you know, in terms of the dosage for kids, some of this have to be specially packed as well. So it's a bit of a different in that sense.
Perhaps to add on, if we could do e-triaging properly, we could probably decrease the queue time, because if you don't absolutely need the medicine, and if you have experience collecting medication delivery safely from the comfort of your own homes, then there will be a lot less patients in the pharmacy, and there'll be a lot less congestion, and there'll be a lot less waiting time.
Yeah. So to give you an example, the pre-order prescriptions, the patients walking out to going out of pharmacy is no more than 10 minutes. All right. But the processes must be in place upstream to facilitate that. Patients must know that I don't need this medication. I can actually pre-order on certain day. When I come to pick it up, I don't have to wait. I just need to announce myself, and the package is available, and it's just handed over to the patient, and patient pay, and out it goes. Out he or she goes to the clinic for administration. That has been done and can be done, proven to be possible. Yeah. So it can be done if you know how to figure out the triaging properly, the patient selection properly, and then pushing of the right service to the patient. We will get there. We can get there. I believe we can get there. Yeah.
So yeah, it's also in a way somewhat of a level loading between over the counter or delivery. Delivery also helps us level load some of this, because as Miko showed in that journey, traditionally is patient come, see doctor, after doctor, they go to pharmacy, and you see the whole crowd moving. So, you know, while a challenge statement is not here, but we are also certainly looking at other aspects of that patient journey to see how we can also improve those solutions. So, you know, this is really one aspect of the entire patient journey actually. And, you know, if we can optimize this, it really fits in. Ideally, I think the previous challenge statement is really looking at the full end-to-end, which certainly is something that if can happen, certainly desirable. This is more or less, I guess, a deep dive into one of the particular segment of the patient journey.